And I assume let's have a move that we allow them to be withdrawn by someone.
So moved.
Second.
All those in favor say aye. All those opposed, the ayes have it. Oh, actually, the noes, raise your hand, please. Which reminds me, I guess I better make space to see that panel. So let me just fix that up so I can see hands. I don't think there will be it. Well, I can't remember. Okay, House Bill 135, Lisa.
This bill authorizes the licensed pharmacist to administer a maintenance injectable medication that is not a biological product to a patient under specified circumstances and requires the State Board of Pharmacy, the State Board of Physicians, and the State Board of Nursing to jointly adopt regulations establishing standard procedures. The bill also requires specified carriers as well as Medicaid and MCHIP to provide coverage for the administration of a self-administered medication or maintenance injectable medication rendered by a licensed pharmacist to the same extent as services rendered by any other licensed healthcare practitioner. There are amendments that make the bill an emergency, change the title, require the regulations to establish procedures for notifying the patient about payment for services, and make other clarifying changes.
Delegate Cullison, I think.
Delegate Kelly. No problem. So this is a bill that the committee passed, I believe, unanimously last session and passed the House floor last session. We did adopt amendments that were some compromises between the pharmacists and the HGAU, Education Advocacy Unit of the Attorney General's Office. There was a robust discussion about whether we should have the amendments the Senate adopted or the amendments that the sponsor preferred. And the subcommittee felt unanimously to go with this set of amendments, which sets up a process for notification about payment and whether you're going to have insurance coverage or not that will be developed through regulation, which we thought was the appropriate way. And that amendment passed unanimously and the bill passed unanimously. So move the amendment.
Is there any discussion on the amendment?
Second.
Thank you. Was that, Saab, you pay so much attention to everything now. I love it. All those in favor say aye. All those opposed, no. Raise your hand.
Aye.
Aye. Aye.
And we need to move the bill as amended.
Yes, please. And is there a second?
Second.
All those in favor say aye. All those opposed, no. Please raise your hand.
Aye. Aye.
Aye.
Okay, and I see no hands raised, so that bill passes unanimously. House Bill 182, Tyler.
House Bill 182 would change terminology from podiatric or from podiatrist to be podiatric physician, and would apply the change to all existing Maryland law, such as executive orders, regulations, and so on.
Delegate Kelly, who's been really busy this week.
Yes. So this bill also passed the subcommittee, not unanimously, but unanimous with the exception of one vote. This is a bill that we have heard for several years on an issue where Maryland is really an outlier. I think there's 36 other states that already allow podiatrists to be called podiatric physicians. This bill goes through the code and changes the term from podiatrist to podiatric physician. It is a bill that has been opposed by MedChi. You guys have all been in the hearings for that. Just a little bit of legislative history. Last year, I think last year, which was the second time in 3 years we'd heard the bill, I think there was a critical mass of members, a significant majority who wanted to move the bill. But instead of bringing a controversial bill out like that, we wanted to give the stakeholders an opportunity to spend the interim figuring out if they could reach agreement. And we particularly directed the opponents to come back to us this session if they could give us a really substantive reason not to pass this bill. The committee felt by and large that standard had not been met. The basic arguments of sort of this will create confusion were not convincing to the majority of the subcommittee. I think we had a discussion about how, real general people aren't often using the term physician anyway. They're using the term doctor, which is already interchangeable. So with that, the subcommittee passed this with no changes, with the exception of one no vote. Move the bill.
Is there discussion?
Second.
Thank you.
I have
All
a-
those in favor?
I-
Yes, Delegate Hill?
Yeah, I spoke with Delegate Kelly earlier, and I very much respect the work of the subcommittee, but I had some concerns since I'm not on the subcommittee. I would appreciate it if, rather than have a long discussion today, if we could just hold the bill 1 week. I'm working on a possible amendment that I respectfully understand the chair does not, the chair of the subcommittee doesn't feel is needed. But I would like to hold the bill and see if I can do that.
You can hold a bill one time. That's the rule until we get to the point where you can't hold a bill anymore because it's too late in session and we are definitely not there. So we will hold this bill till next week to give you time to draft your amendment and for the subcommittee to have a look at it. So if you could get it done, what day does your subcommittee meet, Delegate Kelly?
Thursday.
Thursday. If you could get it done in time for Delegate Kelly's Thursday subcommittee meeting, then when we pick it up again on Monday, it will have been discussed by the subcommittee.
All right, thank you.
Sure.
Thank you.
And thank you, Delegate Hill.
Thank you. Thank you, Delegate. Thank you, Delegate Kelly. And Delegate Kerr, I'd be happy to speak with you about it. Just no personal thing. Thank you.
Okay, you're welcome. Okay, so that bill is held. House Bill 236, Tyler?
House Bill 236 would require Department of General Services to develop and consistently update energy conserving standards for buildings in the state, as well as standards that would help make buildings more safe for bird wildlife in the area, with various room for exemptions as DGS sees necessary for buildings. It's a reintroduction from prior bills that have passed the committee and House in the previous 2 sessions.
Delegate Rosenberg.
And over the course of those 2 sessions, the subcommittee, working with advocates and with the agency, has, I think, refined this so that broadened its support, and so we would move a favorable.
Okay, is there a second?
Second.
Does anybody have any comments or questions?
Madam Chairman,
Yes, Delegate Saab.
I guess this bill is like a bad rash, it never goes away, it keeps coming back every year. And I haven't really had a chance to review it. Would it be okay to hold it next voting session?
Everybody may hold a bill one time, Delegate Saab. So we're at that stage. Yes, that bill will get held till the next voting session. Okay, 1, 2. Well, it's not going quite as smoothly as it did earlier, but that's fine. These things happen. Might be a hard week next week. We may have to reschedule so that we have how many of you have, well, I'll ask it later, never mind. House Bill 257, we are on that, right?
Yes.
I didn't skip anything. Tyler?
House Bill 257 establishes an annual reporting requirement through the Maryland Commission of Civil Rights and certain specified local commissions on civil rights. There was a technical amendment introduced through subcommittee, just clarifying which units of local government would be required to submit the report. The prior introduction without that amendment passed the House unanimously in last year.
Okay, thank you. Delegate Rosenberg.
This is, as Tyler just said, comparable to the bill we passed last year. The amendment is not controversial, it's technical, and it was favorable report recommended by the subcommittee.
And what was the vote, Delegate Rosenberg?
It was, this, I think, was unanimous.
Okay, thank you.
Move the amendment. Second.
Is there discussion? All those in favor say aye. All those opposed, no. The ayes have it. I see no hands in the place.
Move the bill as amended.
Second.
Second.
All those in favor say aye. All those opposed, no. Please raise your hand. The bill passes Looks like unanimously. Okay. House Bill 429.
This bill permits a pharmacist to substitute a therapeutically equivalent brand name, drug, or device product for any originally prescribed generically equivalent drug or device product if the prescriber does not expressly state that the prescription must be dispensed only as directed. The substitution is recognized as specified, and the consumer is charged less for the substitution than the originally prescribed drug or device. There are some amendments that clarify that whether the consumer will be charged less will be based on the consumer's prescription drug benefit or formulary if the benefit or formulary is readily available. And the amendments also clarify that the notice requirement may be fulfilled by maintaining a record that indicates the patient has been notified in writing or orally.
So we handled this bill in insurance and pharmaceuticals, and this is a really consumer-focused bill, allowing them some opportunities to save a little money in their drug pricing by using what pharmacists have at their disposal right now, which is the drugs that can be interchanged, the generic drugs that can be interchanged that have exactly the same therapeutic value. The amendments clarify that you would indeed save money, but that it's based on the formulary of your particular carrier. And we did not, so I'd like to move the amendments on the bill.
Second.
Is there discussion on the amendments? All those in favor say aye. All those opposed, no. Raise your hand. The bill passes unanimously. Oh, sorry, the amendment passes unanimously.
And as amended, the bill passed the subcommittee unanimously. I move the bill.
Second.
Second.
Discussion on the bill as amended. All those in favor say aye. All those opposed, no. Please raise your hand. The bill passes unanimously. House Bill 547, Aaron.
Unmute, Aaron.
Hold on.
Unmute.
Do it again, sorry. This bill prohibits Medicaid from including a frequency limitation on covered dental prophylaxis care, oral health exams that requires the care or exam to be provided at an interval greater than 120 days within a plan year. There were no amendments.
Delegate Cullison?
Yeah, there was actually no concerns. I think the vote was unanimous, if I'm not mistaken.
Thank you, Delegate Penyumelnik. There are no amendments, did you say?
No amendments.
No
There were not.
amendments.
Okay, so you want to move the bill?
Yes, please, I move the bill.
Second.
Thank you.
Any discussion? All those in favor say aye. All those opposed, no. Raise your hand.
Aye.
Bill passes unanimously. House Bill 549, Aaron?
This bill codifies the process that is followed to register a birth certificate for a child who is born using a gestational carrier. There were no amendments. This was also in the Public Health and Minority Health Disparities Subcommittee.
Yes, there was no amendments, and as the fiscal note states, this is really codifying what is done and it's needed. And there are no amendments. I move the bill.
Second. Oh, thank you. Any discussion? All those in favor say aye. All those opposed, no. Please raise your hand.
Aye. Aye.
Bill passes unanimously. House Bill 605, the last bill of this voting session. Aaron?
This bill requires the Department of Health to include mental health first aid among the behavioral health services for which the department provides service coordination for eligible veterans.
This was thank you, a good bill. And as the fiscal note says, it can be handled with existing resources. Good bill, Delegate Kipke. Everyone was in support. I move the bill.
Second.
Any discussion? Seeing none, all those in favor say aye. All those opposed, no. Raise your hand. Seeing no hands, the bill passes unanimously. I want to say to my subcommittee chairman, thank you. You did a wonderful job working with your subcommittees, and subcommittee members, thank you for working so well in your subcommittees. It is a joy to have these bills come out in a format that works for almost all, many unanimous. It's really terrific, and I really appreciate all your efforts to make it look so easy, because I know it's not. With that, I'll see you all tomorrow. Some of you in caucus and the rest of you on the House floor, right? 10 a.m.
Madam Chair,
Yes, ma'am.
I looked on the website and I don't see what time voting session is on Friday. I know we don't know the bills yet, but do we know what time voting session is on Friday?
I'm sorry, we don't have a voting session on Friday. It's
Oh, okay. I heard you
Yeah.
say that and I
And
thought,
I
okay.
did, and I'm thinking of another meeting that I have on Friday, which is good because I don't like to have to adjust a voting session. Monday should be okay. We're going to all be fine by then. And here's hoping, if I don't talk to you personally again, here's hoping that everybody has some reaction, but nobody has a really bad reaction. And know that it's worth it because none of us want to get COVID. So I'm going to be happy for all of us to have our vaccinations. I have no idea if anyone has chosen not to get them. No one has said that to me. You have chosen not to, or you have something? Oh, you have, really? Wow.
It's not that I
Yeah.
chose.
Well, he had COVID in the spring before we
Yeah,
left. I
so
remember
I had
him
COVID in
coughing
the
all
spring
over me
before,
after
so I didn't
CPAC.
see a health benefit of taking it now. So I just thought I'd wait my turn. That's the reason why I decided it.
You're going to wait, because you probably only need one shot, they're thinking too. They're not sure.
I don't know. They seem to change those almost daily, how many shots you had. They came out this past weekend, I thought, and said that we might even need a third, depending on different variant
Oh,
strains.
yeah, variants.
So, yeah, I'm just going to wait my turn. But it's not that I object to taking it. I'd take it.
And that's very noble of you. I'm as one, maybe at least tied with one other person on the committee, the oldest person on the committee. There are two of us. I'm grateful to be able to get it. I would be eligible in the regular world, and if things were in order, maybe I would be able to get it fairly easily now. But because we know it's a mess to sign up for a shot, I'm grateful that
I'm just happy both my parents got it.
yeah, that's good. And they're probably my age. So anyway, thank you all. I'll see you. I know it's going to be another good and productive week, and we'll vote again on the following Monday as we do. Okay? Bye, everyone.